We're going to move on to our next item of business, which is a statement by Jean Freeman on novel coronavirus COVID-19 update. The Cabinet Secretary will take questions after her statement. I would encourage all members who wish to ask a question to press their request to speak buttons. And I call on the Cabinet Secretary, Jean Freeman.
Thank you, Presiding Officer. On Sunday, we had the first positive case of novel coronavirus COVID-19 confirmed in Scotland. The patient is from the Tayside area and had a travel history. While the patient is clinically well, they are being cared for in a hospital in Scotland as a precautionary measure. And I'm sure members will join with me in wishing them a full and early recovery. I know that colleagues appreciate that it is important that we respect the patient's right to confidentiality, and it is not appropriate for me to comment further on the details of this case. Following confirmation, contact tracing has now been completed by the local health protection team. COVID-19 is a new strain of coronavirus which came to light in December last year, is thought to have originated from Wuhan City in China and has spread steadily across the world. As of yesterday, there were almost 89,070 cases throughout the world, with the most substantial outbreaks in Europe currently being in northern Italy. The Scientific Advisory Group for Emergencies, SAGE, who provide expert advice to us, has updated their reasonable worst-case scenario planning assumptions for coronavirus. It is important to stress that this does not represent a prediction or a forecast, but it is sensible modelling based on available data that allows us to plan for the worst-case position. This current modelling tells us that 80% of the UK population may become infected, with 4% of that number requiring hospitalisation and an estimated 1% fatality rate in those infected. These are big numbers, and it is important that I put some caveats around them. Firstly, that this modelling will be continually updated as we learn more about the virus and its behaviour from the data coming from other countries, including Europe, and our UK cases. And secondly, that the vast majority of those who are infected by the virus will have mild symptoms, will not require hospital treatment, and will be able to return to their normal lives in a week to 10 days. But some will experience more severe symptoms, and some will become very unwell. From our understanding at this point, those of us who are older or have underlying health conditions will be at a greater risk of being more unwell than others. We also know that as the number of cases rise, there will be an impact on those in our working population unable to work, either because they are themselves unwell or because they are caring for family members who are. This is a new virus for which we currently have no immunity and for which there is currently no vaccine. That means that COVID-19 has the potential to spread extensively. So the approach we have to take has 4 elements. Firstly, to contain, detecting early cases, following up close contacts, and preventing the disease from taking hold for as long as possible. Secondly, delay, slowing the spread of the disease if it does take hold, so we can better lower the peak, enabling our NHS to better cope with the impact. This is critical, but we need to understand that in slowing down and flattening the peak, we also prolong the length of time we are managing the disease. Research to better understand the virus and the actions needed to lessen its effect, and innovate responses, including in diagnostics, in effective antiviral treatments, and ultimately in vaccine. And mitigate, providing the best possible care for those who are ill, maintaining essential healthcare and other services, and taking steps to minimise where we can the overall impact on society, public services and the community. Let me touch briefly on 2 of these. On containment, where we are right now, requires the steps I outlined earlier, but it is also the phase where the public can help us greatly by actively and consciously using good respiratory care and hand hygiene. So the catch it, bin it, kill it message is important, using tissues to catch sneezes and coughs and then binning them. And good hand hygiene, not only after using the toilet, but also before preparing food and regularly throughout the day, especially if you are in contact with others or with surfaces that others use too. This matters and will help a great deal. When we see that the disease is taking hold, we will be looking to slow the spread of the virus as far as we can and flatten the peak of impact. That is when we will be looking at a full range of measures to help us delay the spread, including potentially extraordinary social distancing measures, self-isolation and restrictions on public events. Evidence from elsewhere in the world has shown that when undertaken in combination, these measures can be very effective. It's important to stress that we are not there yet, and the decisions when to introduce these measures will be taken on the basis of evidence that tells us about the balance between effectiveness in slowing the spread and impact on, for example, the economy. Members will be aware that today we published the 4-Nation Action Plan. This is a product of the joint work going on across the UK. In addition to the approach set out in the plan, we have been working closely with the UK Government and other devolved governments to develop emergency legislation, which is intended to be laid at Westminster this month. This emergency legislation will contain a number of additional powers that would not be considered if it was not for the extreme seriousness of the challenge we now face. The emergency legislation will, for example, allow temporary lifting of some requirements of registration to allow former NHS staff to return to work should they be needed and should they wish, the ability to enhance and deploy staff to health and care settings, and the easing of some legislative and regulatory requirements to, for example, allow ministers to direct school closures should that be needed. The bill will also enable us to require the mandatory vaccinations for health and social care workers, the flu vaccine, if we consider that the spread of the virus may continue into next year's flu season. Given the projections of staff absences and the pressure on the NHS, we may wish to do all we can to protect both the workforce and patients. None of these proposals are being made lightly. In taking these new powers, we will very carefully consider first if they need to be used, when and how they are used. Importantly, the bill will contain a sunset clause to end the existence of these emergency powers after a set period or when the UK Chief Medical Officers declare there is no longer an emergency. Presiding Officer, let me finally briefly outline some of the important work that is underway in health for some time now. All NHS boards have been asked to review their preparedness planning using their pandemic flu plans as a basis, but from that developing specific COVID-19 plans for primary, secondary and social care settings. And there is frequent daily engagement between Senior Health Directorate and clinical officials and boards and their counterparts in the UK. The Scottish Government Resilience Room has been activated and is meeting regularly to ensure plans are in place across government for areas where we anticipate impact. The First Minister, Chief Medical Officer and I continue to participate in COBRA meetings to ensure as far as practical that our responses across all parts of the UK are aligned. Along with other parts of the UK, Scotland has extensive experience in handling pandemic outbreaks such as the swine flu and SARS. We have established frameworks in place, and our preparations to date include the establishment of testing laboratories in Glasgow and Edinburgh, speeding up the identification of confirmed cases and therefore faster contact tracing, which in turn limits the potential spread of the disease. As a precautionary measure, GP practices have been supplied with face masks to ensure that they have available supplies. I have asked National Services Scotland to continue to ensure NHS and, where appropriate, social care continue to receive the supplies they need. We have updated the Public Health Scotland Act 2008 to make the virus a notifiable disease, placing a duty on registered medical practitioners to notify health boards of any suspected case of the disease and on directors of the diagnostic laboratories to notify health boards of any case of the virus being detected. To support our prevention activity, we have enhanced surveillance through a network of clinicians and laboratories to strengthen the early detection of any community transmission, providing important data on early warning of coronavirus in the community and hospital settings, and allowing health protection teams to quickly undertake contact tracing to further limit spread. Our advice to the public has not changed. However, I would like to re-emphasise the importance of good personal hygiene practices that everyone should use at all times to limit and slow the spread of coronavirus. It is understandable that people will become more concerned, and we will continue to provide reassuring, consistent and clear advice. Presiding Officer, up-to-date, accurate information to inform our work and decision-making and to inform the public is vital. Our approach is maximum possible accurate information and transparency. Health Protection Scotland has issued a suite of guidance to health professionals and others for detection and early management, and these have been communicated to all boards by the Chief Medical Officer. This has included sector-specific guidance to a wide range of additional bodies, including schools, colleges, universities, and the oil and gas sector. There is understandable concern amongst people in Scotland about the presence and the impact of this virus. But while we rightly operate to worst-case scenarios, there are some important points to make to put that in context. We do expect more cases, but for the majority of those affected, the symptoms and the impact will be mild. Our contain, delay and mitigate approach is the right one to take, and the public have a critical role to help us by following those straightforward personal hygiene messages. If you've travelled to the affected areas and developed symptoms of coronavirus, you should go home and phone to seek medical advice from your GP or NHS 24 out of hours. Use the NHS Inform website for advice and continuously updated guidance, and NHS 24 have also set up a free helpline. This is a serious situation that we are taking very seriously. We are monitoring it very closely here and across the world, alongside the other UK administrations, the World Health Organization and our international partners. We're using all the expertise available to us and the experience of our NHS in Scotland. We are planning and preparing, letting the science and the clinical advice guide us, and doing all we can to ensure our response is proportionate and effective. We will continue to keep the public and members in this Parliament fully informed as the situation develops. Thank you.
Thank you very much, Cabinet Secretary. The Minister will now take questions. Miles Briggs.
Thank you, Presiding Officer. Can I thank the Cabinet Secretary for advanced copy of her statement today? Understandably, many Scots, especially those with respiratory concerns and compromised immune systems, are deeply concerned about the potential extreme demands that coronavirus could place on our NHS and social care services. Over the last 6 years, there's been a significant reduction in the number of hospital beds, for example, with the loss of 2,762 acute beds. Given the reasonable worst-case scenario planning, which has been outlined by the Cabinet Secretary and the Chief Medical Officer, suggesting a high number of vulnerable patients would require hospitalisation, can I ask what planning is being taken forward for the recommissioning of NHS beds across the hospital estate in Scotland? And secondly, in relation to the calling back of former NHS staff, what steps are being taken to gather this information on where these potential staff members currently reside? And have ministers also considered a publicity campaign to help identify them at an early stage?
Cabinet Secretary.
Thank you. I'm grateful to Mr Briggs for his questions. The first thing to say before I answer your specific questions is the point of contain and delay. Contain is pretty self-evident. The point of the delay is to spread that peak. So in normal course, if we don't do that, the peak will go like that. I can't find the words to describe it, but you see the gesture. What we're doing, and that places significant demand on our health service. But if we can delay the process, then we flatten that peak. And we do that in order to enable the NHS to manage the process. That prolongs, of course, the time that we are managing the disease, but that also allows the emergence, if the research and the science brings it, of additional antiviral treatments and potentially down the line a vaccine. So that's the point of delay. So in planning that, We are currently looking, and of course, as the National Clinical Director said this morning on radio, not everyone will appear at the one time, and not everyone will appear in the one place at the one time. So as we plan it, we are looking, therefore, at, as it scales up, what current NHS business as usual work, is it possible to pause in order to create more space? What work, and I'm seeing COSLA tomorrow, and the chief officers of our IJBs are already engaged in this, what more can we do in order to create greater impact on the delays in care for those who are clinically ready to leave hospitals but are not yet leaving? And in addition then, what does that tell us about what more we might need in terms of additional capacity? So all that work is underway, and at this point it is too early to give you any kind of definitive answer, but you have my absolute assurance, as we have done up until now, that I will make sure that you and colleague party spokespeople in health and others are kept fully informed as we undertake that work. In terms of calling back staff, again, we don't need to do that yet. So the plans are being worked up about how we might reach out to. Now, some staff are retired, others, though, have taken a break in their career for personal or family reasons or whatever it might be. So we need to be able to reach out to those individuals and to understand if they're willing and what would it need for them to be able to come back, perhaps part-time, perhaps more flexible. But we also need to build into any return time for people to upskill themselves again, so that they are confident in that clinical environment. So that is all underway in order to put those plans in place.
Thank you very much. Monica Lennon, to be followed by Alison Johnson.
Thank you, Presiding Officer. I'm grateful to the Cabinet Secretary for advancing of her statement and thank her and the Chief Medical Officer for their briefings with opposition parties to date. Scottish Labour, of course, supports the international and UK-wide efforts to contain, delay and mitigate COVID-19, and we will continue to work constructively with the Scottish Government to ensure the public is well informed and that we are as prepared for all scenarios as we can be. Can I ask the Cabinet Secretary on the issue of NHS 24? I understand already that there has been a spike in calls to that service. Based on current modelling and scenario planning, can I ask what level of calls is the Scottish Government expecting and what resource and contingency measures are in place for that? And on the issue of NHS and, of course, social care staff, can you say more about the advice that's been given to staff and discussions with trade unions? And in particular, in the event that we experience school closures in parts of the country or we see an impact on social care, to those staff who are worried about childcare or other caring responsibilities, can you say more to reassure them about what might be in place to support and advise them at that time?
Cabinet Secretary.
Thank you very much. I'm grateful to Ms Lennon, and of course, as she will know, I've offered a briefing to party spokespeople and party leaders after this statement if they wish it. I should also say that the Four Nation Plan, I know, has been emailed by Mr Day's office to all members, so everyone will have sight of that. In terms of NHS 24, on the 1st of March, which is the most up-to-date figures I will have later the figures for tomorrow, there was an increase of 44 calls to the NHS helpline, a significant increase, though, in the number of views of the NHS Inform webpage. So the increase in calls are important, but they're not yet overly significant. However, NHS 24 has a free helpline for advice, as well as the 111 helpline for those who are experiencing symptoms and would receive a clinical triage through that. And we have asked NHS 24 to do some scoping work about how they think they might need to scale up and what is needed to allow them to do that. That also is, of course, part of what all our boards are looking at as we speak. In terms of staff and unions, so an initial call was made to all senior figures in Scotland for all of our unions involved in the NHS this morning. We will then undertake detailed conversations with them about the detail of all of this and what that might mean. NHS Scotland's staff policies cover the situation, for example, if a member of staff is asked to self-isolate and ensure that that does not count in their absence record. There are policies in NHS around carers and caring responsibilities and so on. We've asked that those are double-checked, and we'll have that discussion with unions to make sure that they are as good as we need them to be for this particular situation. And I have asked and hope that it has already happened, that detailed information to all NHS staff has been circulated with a repeat of the guidance, certainly, but also with a commitment about how we will continue to keep them informed about what is happening, even if they are not necessarily in a particular area where they are actively engaged in some of this. In terms of the other employers elsewhere across our sectors, I know that my colleague Ms Hislop, in her portfolio responsibility, is engaging with business and others in order to ensure that they are planning, but also thinking about how they will help their employees to help us in the particularly important phases that we need in order to manage the spread of this virus.
Thank you. Alison Johnson, to be followed by Alex Cole-Hamilton.
I thank the Cabinet Secretary for advance sight of her statement and for her ongoing communication on these issues. I think given that the symptoms of COVID-19 are similar to other respiratory illnesses, this may result in increased contact between patients and GP practices. And I'd like the Cabinet Secretary to confirm how the Scottish Government plans to reassure people who are concerned and to ensure that support is available to GPs so that they don't become overloaded. And the Cabinet Secretary has touched on the issue, but unpaid carers are very concerned about the impact their absence, if they have to self-isolate the person that they are looking after, may be affected. And I'd also like to understand what consideration has been given to those on 0 hours contracts, those in insecure work, who, if they are absent, will receive no pay whatsoever. Thank you.
Cabinet Secretary.
Thank you very much. I'm grateful to Ms Johnson. The case definition, if you like, of this virus is a cough, fatigue and difficulty in breathing. And so people who have those symptoms, if they've got a travel history from the areas currently affected, be that in Europe or elsewhere, and again that information is available on the NHS Inform website, then using the NHS 111 number will take them through some clinically appropriate questions and then produce bespoke advice for that particular individual about what now to do. And of course, as members know, we have a range of different testing methods across all our boards, all of which are designed to prevent the spread of infection. So it's either in a specially designated area in a health board or the drive-through testing that members may have seen in Lothian and appearing in other parts of the country, or community testing where the testers will come to you. So that's what people should do. Those are the symptoms. Those are not, strictly speaking, the symptoms of flu, for example, although there are comparisons. So the best thing to do if you're concerned is use that number or use the Inform website to check and get their reassurance and the additional actions if that is what is required. In terms of GPs, it's actually the whole primary care area. Work is underway with GPs, with primary care teams, with dentists, community pharmacy and ophthalmics, optometry in the community to understand and engage all of them in the work that we need them to do, both to provide advice to individuals, to ensure that they have the supplies that they need for their own staff and others, but also engage them in helping us with those phases that or those elements that I described of contain, delay and mitigate. Unpaid carers and those who are more vulnerable, either in health terms or in other terms in our community, are an area of particular concern to us. And so where that relates to employment, as I said, my colleague Ms Hislop has that work underway, but equally my colleague Ms Campbell alongside us are looking at what more we can do for those who are vulnerable in our community, not only in terms of their health, but possibly also in terms of their location. And the unpaid carers point who may be concerned about what happens to the person I care for if I become unwell, that is part of the social care response that I will be discussing in more detail with COSLA tomorrow.
Thank you very much. Alex Cole-Hamilton to be followed by Emma Harper.
Thank you, Presiding Officer. Does the Health Secretary agree with me that if event organisers want to avoid the restriction phase, they must help now with the containment phase? Well over 100,000 people go to the football each week, but stadium toilets often have cold water or even no water at all and empty soap dispensers. People go on to shake hands and celebrate with those sitting around them. So if events like these are to continue, as I hope they can, does the Cabinet Secretary agree with me that it is critical that decent wash facilities are in place, and will she contact the SFA and SPFL's Coronavirus Action Group to ask them to urgently ensure these facilities are up to scratch?
Cabinet Secretary.
So what I do agree with from Mr Cole-Hamilton is that everyone, every single person in this chamber, every member of our families, every employer, organisation, entertainment venue, everyone has a serious responsibility to help us here in this containment phase with those very simple steps that I outlined. So if an entertainment venue, a sports facility, an employer needs to ensure that the resources are there to allow people to effectively wash their hands, to bin tissues and so on, then I would urge them very strongly to do that. I know that our officials from Active Scotland are in contact with the various sports bodies, and we will take that work forward with them, and my colleague Mr Fitzpatrick will be ensuring that that happens so that we can ensure that people are doing what they need to do right now, bearing in mind that if the virus takes, if the disease takes hold in the community and we move into the delay phase, then we will be looking at the kind of decisions that Mr Cole-Hamilton hints at, but we'll be looking at those in that proportionate and reasonable way in order to ensure we get the balance right between effectively protecting our citizens in terms of their health, but also ensuring that we minimise the impact where we can on society and on the wider economy.
Emma Harper to be followed by Brian Whittle.
Thanks, President Officer. I remind Chamber that I am still currently a registered nurse. Can the Cabinet Secretary again emphasise the impact... Yes, I am. Can the Cabinet Secretary again emphasise the impact that can be made to reduce the spread of COVID-19 by members of the public, such as washing their hands frequently, not touching their face, covering their nose and mouth with a tissue when coughing or sneezing? She's already highlighted this, but this is so important.
Cabinet Secretary.
And I think our marketing campaign, Mr Briggs, has just produced its first result. So I certainly know where to find Ms Harper. I would simply concur. It is something that we all know we should do, and yet we become lazy about it. Every single one of us, we do it. You know, we might wash our hands. I hope we wash our hands after we've used the toilet. We don't always think about doing it before we prepare food. And so on. We certainly teach our children to do these things. We now need to become the exemplars of that personal and respiratory hygiene. And that onus is on all of us to do that and to encourage everyone that we are in contact with, be it family members, friends, colleagues, or whatever, to also make sure that all of us are doing that. There is, in doing so, not only a significant impact on the containment of this virus, there will also be an additional boon to public health in general terms.
Brian Whittle to be followed by Willie Coffey.
Thank you, Presiding Officer. I've been contacted by concerned constituents who regularly commute to London by plane or by train. So can I ask the Cabinet Secretary what advice is being offered to companies with employees in this situation, and also to transport operators and transport hubs, and how is the Scottish Government and UK Government ensuring that advice is heard?
Cabinet Secretary.
So at this stage, because as I said, we have one case, in the UK we have 40 cases. I should make the point that of the 40 cases we have in the UK, 15 of those patients have now been discharged from treatment as well. So that is an indicator, I think, to us, what I said earlier about the majority of us will experience this in terms of mild symptoms. So at this stage, we are in that containment phase, and so it is by and large business as usual, taking those important personal precautions in terms of our own respiratory and hygiene health. Employers will be looking at what plans they need to make should we have to move into the delay phase, and that is, we expect that we will, so they'll be looking at what plans they have to make. And in terms of public transport and gatherings and so on, as I said in my statement, it is in the delay phase that we give serious consideration to whether or not we need to advise the curtailment of some of those activities, balancing what the evidence tells us about the positive impact curtailment will have on the spread of the disease against any impact that that might have on individuals, on normal life and on the economy and so on. But we're not at that point yet.
Lee Coffey, to be followed by David Stewart.
Thank you. Can the Cabinet Secretary set out the process of contact tracing for the coronavirus case that was identified in Tayside and of great interest across Scotland, and reiterate the very low risk posed by the possibility of passing someone in the street or in a shop who has the virus?
Cabinet Secretary.
So I mentioned earlier in my statement the point about, so I'm grateful to Mr Coffey, I mentioned earlier in my statement the point about social distancing. So generally speaking, the advice that we have, the scientific advice that we have, is that the face-to-face contact within a distance of 2 metres for up to 15 minutes is the point at which we are at greater risk of contacting. This comes through the droplets that are expelled if we sneeze or cough. So it is not something that is particularly circulated in the air around us, and it isn't something that we would contract by passing someone in the street or in the shop. We can contract it from surfaces, so that is why regular hand washing is important. But that is, by and large, not only what I said earlier about the case definition, but about how the coronavirus is spread. And therefore, as we've said already many times, the importance of those simple personal steps. In terms of contact tracing, what happens is that an individual who has tested positive is then asked to take the local health protection team through everything that they have done. If they have a travel history, for example, everything they have done from the point where they were in the area that is a designated area for coronavirus, for example, one of the areas in northern Italy or in other places in Europe, in Iran, in South Korea, and indeed in China. What they have done, by what means did they travel, who was in contact, close contact with them, family members, possibly work colleagues, it depends on each individual case. All of those individuals are then traced and are assessed clinically as to their own state of health, and if necessary, also tested. Close contacts in particular are tested. So that is what contact tracing involves, and obviously the more cases that we see, then the greater burden of contact tracing there is on local health protection teams. And again, that is another area where we're asking people to assess whether or not additional resource is needed for them in order to undertake that work should the number of cases significantly increase.
David Stewart, to be followed by Christine Graham.
Thank you, Presiding Officer. The Cabinet Secretary will be well aware from the World Health Organization statistics that coronavirus is highly infectious, and it's the older people with pre-existing conditions who are most at risk. For example, in China, the highest death rates were from those with cardiovascular disease, diabetes and chronic respiratory disease, in that order. How will our most vulnerable citizens be protected?
Cabinet Secretary.
So they are protected in part, as I have already described, about the way we all protect ourselves. Where they have particular concerns because of their underlying conditions, then their GP or NHS 24 can give them any specific additional clinical advice. As we move from the contain stage through into the delay, then we may, depending on the clinical and scientific advice we receive, provide additional advice and steps to those particular groups of people that will differ from others. But at this stage, we're not there yet. And the evidence that you refer to, quite rightly, I'm not questioning that evidence. It's what currently is guiding us. But that will be refined, as I said, as we have more data from how the virus is spreading in other countries and our own cases in the UK. So we'll refine, the modelers refine that data as they go. And that may point us either to additional conditions that we should pay particular attention to, or to a shift in how the virus is impacting as it spreads to other countries in the world.
Christine Graham, to be followed by Liz Smith.
Thank you, Presiding Officer. Further to question by David Stewart on older people. Many of us are essential to the economy, to public services, volunteering, caring for others young and old, and indeed may even be called up as additional resource in the NHS or perhaps even schools. How will the Scottish Government balance the reasonable message of safety first without scaring older people, important in their own right, but also with a significant contribution to society?
Cabinet Secretary.
So I couldn't agree more that us older people are absolutely vital to our society. In all the ways and in all seriousness, I agree with what Ms Graham has said. It is absolutely not our intention to scare anybody. I think we have been clear on that since the first case, since we announced the first case, and all the work that has been undertaken by the First Minister, Chief Medical Officer, National Clinical Director, myself. Our job is to be completely honest with people about what we understand to be the position, what the science and clinical advice leads us to expect as worst-case scenarios, what the caveats are around that, the approach that we're taking, and therefore what we need the public to do and where they can go for the expert clinical advice that they might seek. That includes older people as well as others. So it is absolutely not our intention to scare, but to inform and to reassure and to provide people with the information that they need, whilst we also get on and plan what we need to do in the health service and elsewhere for a situation where the disease begins to take hold in Scotland, and we are looking to delay it and manage it against all those factors that I've outlined earlier.
Liz Smith, to be followed by Ruth Maguire.
Could I ask the Cabinet Secretary whether she will have discussions with the health boards about the impending proposal to reduce the number of laundries in hospitals from 8 to 4? Because obviously that is of very considerable concern given the situation with coronavirus.
Cabinet Secretary.
I'm grateful to Ms Smith. That's a very important point. It is part of what we've asked our health boards to consider. It's not just the number of beds they have, the number of staff they have, the supply chain into boards and to primary care, of course, for which they are responsible. It's also about the other facilities in terms of estates, laundry and so on. So we will pick that up with them, and I'm very happy to update the member as we make progress in that.
Ruth Maguire, to be followed by Lewis MacDonald.
Thank you, Presiding Officer. In light of the announced plans for UK-wide emergency legislation, can I ask the Cabinet Secretary how the Scottish Government is working with other administrations to ensure that any such legislation provides the appropriate and tailored means to tackle coronavirus in every part of the UK, given that there already may be different powers in different nations?
Cabinet Secretary.
I'm grateful to Ms Maguire. It's an important question. We are working with the UK Government on the emergency legislation, our relevant officials and theirs cooperating, as is the case for Wales and Northern Ireland. Our approach at this point, because it is emergency legislation, the nature of which means that we need to have the option of those additional powers relatively soon, we have taken a view that says that even where we think we might have some of these powers already, we will simply bring forward to this Parliament that legislative consent motion in order to take the additional powers. The key then is each of the 4 governments taking decisions about when and how to use any one of those additional powers. So some of the emergency powers are powers that we don't currently have. Some of them are powers that arguably we do, but the emergency powers eases that for us, and the same applies in Northern Ireland, Wales and in England. So that is the approach that we're taking. The key on the emergency powers is as much having them as much as that is about how and when you take decisions to use them. And of course, the LCM involved will of course be for this Parliament to debate and decide.
Lewis MacDonald, to be followed by David Torrance.
Thank you very much. Cabinet Secretary, you mentioned the importance of research and of innovation to lessen the impact of this virus, including diagnostics, antiviral treatments and ultimately vaccine. While clearly these will all be global efforts, I wonder if you would like to make comment on where Scotland in particular has the expertise and the ability to input to finding those outcomes in due course.
Cabinet Secretary.
So Mr MacDonald is absolutely right. They are global efforts. They're global efforts being pursued with some urgency, as you might imagine. Scotland is an active player in those global efforts. From memory, although I'm happy to provide them with more detail, but from memory I know that Edinburgh University, for example, is one of the leads in some of the trials that are underway. So there's not only work going on to look for what might be the right vaccine here, but we are some months away from that, and as people would appreciate, it's not going to assist us in the current situation. But there's also work looking at existing antiviral medicines and treatments that whether or not, although they might have been developed for a particular virus, whether or not with any adaptation they could be effective for this virus. So that work is underway, and as you would expect, given how successful Scotland is in terms of our research work, particularly, well, amongst other areas in clinicals, work in all four of our major universities in Aberdeen and Dundee, Edinburgh and Glasgow and others, then we are actively engaged in all of that. And across the UK, an additional £20 million has been contributed to that particular research effort.
David Torrance, to be followed by Jamie Green.
Thank you, Presiding Officer. Can the Cabinet Secretary set out how the Scottish Government will ensure that organisers and attenders of large-scale events will be kept informed of any changes to current coronavirus advice which may affect such events or lead to their cancellation?
Cabinet Secretary.
Yes, so again, because we have stood up SCORE and the Scottish Government's resilience operation, which the First Minister chairs, then that obviously involves Cabinet Secretaries across the Government's portfolios, all undertaking work in their own area. And again, it is my colleague Ms Hislop looking at cultural events that are and organisers, sporting events, other types of events, and getting in contact with those organisers so they understand where we currently are in terms of coronavirus. They pick up some of the points that were made by Mr Cole-Hamilton about making sure resourcing is there for people to wash their hands properly and so on, but also maintaining that contact with them so that they are alongside us as we go actively through the containment phase and contributing to that, but also are there as one of the factors that we would play in when we come to look at whether or not we want to place any restrictions on large-scale events. And as I would stress again, we are not at that stage yet, and we have not made those decisions yet. There are a number of factors that would need to come into play before we did.
Jamie Green, to be followed by Elaine Smith.
Thank you. Clearly, nurseries, schools, colleges and universities are environments of concern where close contact poses risks of localised outbreaks. So can I ask what clear advice is being given by the government to parents, teachers and those in charge of these environments so that there's absolutely no doubt about A, what they're able to do freely of their own accord versus B, what they may be required to do if instructed to do so by the government or authorities?
Cabinet Secretary.
So at this point, Health Protection Scotland has issued detailed advice in terms of health measures and steps, the nature of the virus and so on, through the relevant networks, Universities Scotland, Colleges Scotland, local authorities, as one of our key partners in the resilience effort. That is advice to people about much of what we've discussed in the Chamber today. Interestingly enough, Mr Green may not have had the opportunity yet to read the Four Nation Action Plan, but one of the things that is said in that is that, as Ms Graham said, the particular group that is most at risk is elderly people and people with underlying health risk conditions. But at this point, it appears to be the case that children are not particularly vulnerable, nor are pregnant women. So all of that is being led by the science, as I said earlier. That advice has gone out. As matters develop, further detailed advice will continue to go out in much the same way as I continue to keep members here updated on our developments.
I've got two final questions. First from Elaine Smith and Jamie Halker-Johnson.
Thank you, Presiding Officer. Could I ask some further detail about what containment means? So, for example, would the Government not consider being more proactive by recommending against large gatherings before the virus spreads further, rather than waiting until it does and then simply delaying the spread, as the Minister said in the statement? Should the Scottish rugby fans who were at last week's Six Nations in Rome and who were mixing with Italian fans from the north before the lockdown of the north be afforded a test as a precaution? And will the Government disaggregate the data on coronavirus by sex so that we can see if there's a difference between men and women in terms of infection and mortality rates? And if so, what the biological and social factors may be that would cause this?
I was hoping for a quick question and answer. Cabinet Secretary.
So the disaggregation of the data would be done initially with us as part of that UK effort. I think at the moment the primary focus for the scientists and the modellers on the basis of that science is to help us understand the virus and its nature and its spread as much as we can. We will certainly feed that ask in. In terms of rugby fans who were at the game in Italy, then the advice that they are receiving is the advice that is there for others, and that is if they feel symptomatic and the symptoms that I've described, then they should be getting in touch by telephone with either their GP practice or with NHS 24. And the point about large gatherings and why not do that now as opposed to having it under consideration for later is that all the evidence tells us that to do that whilst we're in a situation with one case before we reach the point where we understand that containment is not working and the disease has taken hold in the community would make the restriction on large gatherings less effective than if we do it in the delay stage. So this is a lot of what I've set out is not exclusively what I, as the Health Secretary, think is the right thing to do. It is led by the science and the clinical advice. That is why it is a four-nation UK plan. And the work that I have set out and that we are undertaking and the approach in terms of those four elements is shared right across the UK based on that scientific and clinical advice.
Jamie Halker-Johnson.
Thank you. The Cabinet Secretary will know that my region welcomes tourists on cruise ships from across the world. I was just wondering if there are cases reported on board, as there have been in other places, what additional support can be provided to those often small NHS boards, and whether there are any plans in place to move any vessels with cases on board to areas where increased medical support can be provided.
Cabinet Secretary.
So in terms of the second part of your question, that will be part of the consideration. My colleague Michael Matheson and others will be looking at as part of their resilience planning, should that happen. Obviously, it has not happened. In terms of additional support between one health board to another, that is standard across our NHS, so it would be simply part of the existing resilience plans and would be something that we would expect boards to be doing, and they do it. There is guidance there in terms of ports, although in terms of how that affects our devolved powers, but there is also guidance from the UK Government in terms of all ports with respect to the reserve powers that they hold.
Thank you, and apologies, we've no more time for any more questions. We've already eaten into this afternoon's debate. We'll just move on to the next item of business.